Okay, this is going to be Dr. Mcdougall's Mentors. It's from the book John Mcdougall, The Doctor Who Fought for You, written by me, Pete Rogers. We're going to be talking about Roy Swank. Roy Swank was an MD, PhD, Harvard-trained neurologist, and he has the best results of any doctor in the world for the treatment of multiple sclerosis. In patients diagnosed early and put on a low-fat diet, especially low-saturated fat, they had 95% reduction in neurologic events. That's a lot. And he had 34-year follow-up and even longer follow-up than that. I know he published a 34-year follow-up. Dr. Mcdougall's YouTube channel has several videos of Dr. Swank lecturing. They were friends, you know. And Swank was in Canada for a long time, and then he came and worked at Oregon, and Dr. Mcdougall sort of helped out with his MS program. He especially emphasized avoiding saturated fat. He didn't set any limits on starches, vegetables, and fruits. The one little disagreement was Swank would let the patient have PUFAs, polyunsaturated fatty acids. I think that was a mistake. Dr. Mcdougall thought that was a mistake, but still, you know, the guy had incredible results. He looked at the data coming out of Norway, and what he basically saw is that people that lived in the coastal areas where they were not having dairy, they had a very low incidence of MS, whereas the people in the central dairy parts of Norway had a very high incidence of MS. And he said to himself, too, some people say, well, you know, the further north you go, the more MS and autoimmune disease you have. And some people say, well, it's because of sunshine. And Swank said, no, it's not because of sunshine, because from the center of Norway to the periphery, there's not that much difference in latitude. That's not the point. It's not the point of sun exposure, vitamin D. It's a different diet. That's the most important thing. That was his conclusion about that. He noticed that the high-fat diets, especially sat-fat, had markedly increased incidence of MS. And when he followed his patients long-term, the ones who didn't follow the diet and had more fat, especially sat-fat, they had poor outcomes. He said it just takes a small amount of sat-fat, and patients had really lousy outcomes. Populations with very low-fat diets like China. He visited China around 1960, and he said they couldn't find a single multiple sclerosis patient. It's also been the case like rheumatoid arthritis in Africa. There wasn't a single case reported before 1957. You come to the United States, blacks got autoimmune disease off the charts. Okay, so the point is, you know, you eat these low-fat plant-based diets, people hardly ever get autoimmune disease. And usually what prevents the disease is also usually good for treating it. You know, like Dr. Mcdougall says, if you want to get the cure, you got to stop the cause. Okay, Dr. Swank did a lot of studying of blood flow. He studied blood flow in different types of animals, you know, like a hamster, for example. They could study the vessels inside the cheek pouch of a hamster and watch them in real time. With a microscope, you could photograph them. Later on, people did similar experiments in the eye. Some people have done them now below the tongue, sublingual vessels. And he noticed that you feed people a high-fat meal, and it sticks all the red blood cells together. They sludge. And he actually felt that this was causing a significant drop in oxygen delivery. Peter Quo had measured about 15 to 20% in the 1950s. Dr. Swank in one hamster recorded 35% drop in oxygen delivery. I don't know if there was simultaneous sodium. I didn't hear it mentioned, but I wonder if there was, because that's a vasoconstrictor, might also decrease the amount of oxygen getting to the tissues, and that's quite a bit. So why do you get blood sludge? Because they're high-fat diets stick the red blood cells together. I think sodium's a problem as well because it vasoconstricts, narrows the diameter of the arteries. But high-fat meals stick the blood together. So when you pump from your heart, you're pumping a milkshake instead of pumping water. Blood pressure goes up, so you get hypertension. The hypertension over time damages the arteries and causes atherosclerosis, including intracranial atherosclerosis. But he felt that the blood sludge, where the red blood cells were stuck together by the fat, the bulkiness of it was somehow irritating the blood-brain barrier, making the blood-brain barrier more permeable. And this was allowing the autoantibodies to get into the brain parenchyma tissue and cause demyelinating lesions of multiple sclerosis. Okay, let's see what else. The drug therapies for MS are super important, and they don't work very well. One of the things you'll see one of the things you'll see is that conventional medicine always wants to sell a drug, and the doctors are only trained in drugs, so they think everything else besides drugs is nonsense. But they don't ask themselves, well, gee, how come your drug doesn't work? You know, it's a lot of money, $70,000 for a year of a medication, and it probably doesn't work too well. Excuse me, sorry about that. Lots of MS patients have really lousy prognoses and do poorly, and that's because even the rich ones, I know some of the rich ones, and they don't do so well either. So what I'm saying is, here's this guy Swank. He's got these incredible results. He's a pretty smart guy, MD, PhD from Harvard, devoted his whole life to studying this stuff, following these patients. He's got the results. He's published the results. He's done the research. I would go by what he says until proven otherwise. Why don't you do it? You got nothing to lose. You're eating a healthier diet anyways. So he said as little as 8 grams per day of saturated fat resulted in a 3-fold increased risk of dying from multiple sclerosis. So sat fat is super bad. Here's the published reference in the Lancet Journal, 1990. And here's some other articles. You know, you can look for there for yourself if you're interested. Here's Dr. Swank's book, the multiple sclerosis book. And like I said, too, he's got lectures at Dr. Mcdougall's YouTube channel. Dr. Mcdougall's got a newsletter on him. Multiple sclerosis, fat-oil relationships. So here's one of Dr. Swank's publications from 1991. From between the years of 1949 and 1984. So that's a lot of follow-up. Okay, that's 35 years. Patients put on the low-fat diets. Okay, the patients, when the earlier their treatment starts, the better. High sensitivity to fat suggests that saturated animal fats are directly involved in the causation of multiple sclerosis. Oh, he says minimally disabled patients who followed the diet recommendations deteriorated very little, if at all, and only 5% failed to survive the 34-year follow-up. So lots of MS patients with conventional treatment and drugs, they're dead within 10 years. Most of his patients, 95% of them, survived 34 years. That's pretty impressive. Whereas if they didn't follow the diet, 80% of them died in less than 34 years. So, okay, effective low saturated fat diet in early and late cases of multiple sclerosis. The greatest benefit was seen in those patients with minimum disability at the start. When those who died from non-MS diseases were excluded, in the analysis, 95% of those who survived for 34 or more years, they were physically active. So they weren't disabled. They had their ADLs, activities of daily living. Oh, there's a good video. This is one of them at Dr. Mcdougall's YouTube channel about blood sludge. And what you'll see is after the high-fat meal, all the red blood cells stick together. So instead of flowing individually as they normally should, they now flow as a big blob, like a big giant submarine sandwich, which is hard to push through the arteries. You look at a capillary. Capillary normally is only about 5 microns. A red blood cell by itself is 7 microns. It's bigger than the capillary. So you stick a whole bunch of them together by fat, and they're going to have a hard time getting through that capillary. Not good. Okay, so here's a picture of it. The red blood cells being about 7 microns in diameter. The biconcave disc is the shape of a red blood cell. They have to fold back on themselves a little bit to pass through the capillary, which is only 5 microns in diameter. And you can imagine, you put these into a big blob of fat, it's going to be harder to push them through that capillary. Blood pressure is going to go up. Okay, the reason this all happens is because on the outer surface of a red blood cell, you have a negative charge. It's called a zeta potential. Molecules which overcome the zeta potential, they're called bridging molecules, like a big positively charged molecule, and that will stick the red blood cells together. LDL cholesterol does that. LDL cholesterol is a bridging molecule. It's the most important, most common of the bridging molecules. So that will cause blood sludge, thickening of the blood, increased blood viscosity. You need to pump higher pressure to pump that blood through. What else will do it? If you got leaky gut and you get the bacterial endotoxins going through there, LPS and LTA, that'll lead to blood sludge effect. Excessive free iron in somebody who's chronically, for decades, iron overloaded and has free iron in the blood, that can do it. Excess uric acid, if you're eating way too much high fructose corn syrup, fibrinogen. Well, the fibrinogen gets distorted by postprandial bacterial endotoxin. So if you have leaky gut and you get the bacterial endotoxins, they'll distort the shape of fibrinogen, change it from an alpha helix, like a cylindrical shape, into a beta pleated sheet, a flat shape. It stacks up and then can precipitate out a solution, meaning clot. IgM antibodies are big. They're like this big multi-pointed star. And they're positively charged so they can stick the red blood cells together. So an acute infection will increase your risk of clotting. Atherosclerosis is just a blood clot, by the way. Being dehydrated makes it a little worse. But anyways, that's sort of the big scoop on. I got whole long lectures on atherosclerosis. We don't got to go into all the detail on that. There's plenty of other things that make a person hypercoagulable. Let's see. There's the bridging molecule sticking the red blood cells together, making it harder to push it through that capillary. Here's peak lipemia. So this is Peter Crow, the cardiologist in Pennsylvania in the 1950s. So he found that if he gave people sat fat they would start going up around 3 hours and stay peaked until, let's say, about 7-8 hours. And he would check their blood lipids every 30 minutes. And at peak lipemia in the blood, the people were most likely to get episodes of cardiac angina, chest pain. These were patients with known cardiac angina. So it's a little bit of a wild and daring study to feed all these patients high-fat meals. And he basically proved it's the high-fat meal that causes cardiac angina to come along because you get less oxygen delivered to your tissues. And it's not just the big epicardial arteries on the outside of the heart. There's intramyocardial small arteries that go into the muscle. And, when you fill the blood vessels up with fat, it's harder to get that oxygen delivered. Okay, Ray Rosenman and Meyer Friedman also tested this on the people's eyes. And they found the same thing, that you get markedly reduced blood flow and with the high-fat meals. Oh, here's the papers. Angina pectoris induced by fat ingestion. Friedman's paper, effective unsaturated fat upon lipemia and conjunctival circulation. Yeah, they had a big 80-fold microscope and put it over people's eyes. You could see the blood flow diminishing when they ate that high-fat meal. Anyways, that was Roy Swank, the great genius who figured out how to treat multiple sclerosis. And unfortunately, not many people listened to him, but he treated very large numbers of patients and had all this follow-up, but he's largely ignored still by conventional medicine, which is very unfortunate. But anyways, he's one of the great mentors as well of Dr. Mcdougall, so hope that was helpful.